It's time for DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio. Today I'm in the show, actually on the show alone in the studio. That doesn't happen too often, Joe, but we couldn't get into with the other doc today. So
gotcha.
What I'm going to do today is something a little bit different. I have some slides, and it's going to be more of like a picture show that I want to share with our listeners. And so we have different topics, and certainly if you have any questions, I would invite you to call in to 480-745-1033. First of all, what I'd like to start off with is something that I find is very fascinating. When I've done some lectures around the country and so forth, one of my, I don't want to say signature talks, but one of my talks that really gets a lot of interest is when I talk about certain foods in their natural state that look like the organ in the body that they affect. So we're going to have a little bit of fun, and I want to share some pictures with our listeners today. Why don't we get the first slide up, Joe, if we can pull that up. Now, actually, you can go to the next slide. What I'm going to show you today are different pictures of different organs in the body that look like the food that affects that body part. Now, any listeners out there, if you're interested in the research to back this, do not hesitate. We can post all the research. Everything that I'm going to talk about today has been researched and validated and is actually in the literature. So, for example, if you look at this picture, blueberries, when you cut a blueberry in half, it looks like the human brain in cross-section. And, we know...
Wow, it sure does, doesn't it?
It does. It really does. And you can see, this is an MRI, and you can see how really closely that picture matches the blueberry. What's really interesting, you can go to the next slide, is that blueberries have been found to be absolutely effective and beneficial for the brain, for brain function. The nutritional value of blueberry is very high in vitamin C, manganese, but really what it does is it extends across the blood-brain barrier to reduce age-related damage to the brain. And so there's, clearly benefit to the human brain when we eat blueberries. Some studies show that it increases memory and so forth.
Does that work with like blueberry muffins?
Well, a lot of sugar is added to that. But, in the natural state, blueberries absolutely have an effect. And if you can see, on the slide there, if you do not wash blueberries until they're ready to eat, because that little white protective coating?
Right, yeah, absolutely.
It protects it and it keeps it fresh. And so, that's pretty important to keep in mind. Let's go to the next slide.
I recently ate blueberries right off a bush.
Oh, my God.
I know somebody out here that grows them, and are they good.
You can't get much fresher than that. This is broccoli. And if you look at it, this is a very high-def electron microscopic picture of the bronchiole of the lung. And, you can see how closely it resembles broccoli. And if you can go to the next slide, we know that broccoli as an antioxidant has clear benefit to help with lung and actually help to prevent even lung cancers. There's some studies showing that. There's a phytochemical in the broccoli that are metabolized into, anti-cancer properties.
So
which is
this what the supplement makers extract out of these?
Yes. And that's really,
Wow.
I think in the next probably, 5 to 10 years, medicine, clearly, we're going to be using a lot more natural things. We know now that there's chemotherapeutics that come from bark, the tree of a bark and the yew tree and all that kind of stuff. But I just think this is interesting when you just look at the fruit and look at the part of the body that it affects, there's a resemblance. Now, that's not to say that broccoli doesn't help other parts of the body.
Right.
This is just just an example that is just a way to remember that it looks like the part of the body that, one of the parts of the body that it affects. Let's go to the next slide.
It takes just a second
That's
to
okay.
catch up
We're
after
gonna,
that.
We're going to talk about the carrot, and if you cut a carrot in cross-section, there's just a natural appearance of what a carrot looks like. It resembles a human eye.
Oh.
And clearly we know that the beta carotene that's found, you can go to the next slide, that's found in carrots have been found to be very beneficial for the human eye. And, it's interesting because the eye, there's a lot of nutrients now that we know help to protect the eye from age-related macular degeneration. And so, a lot of the antioxidants really help protect the eye. I don't know if we can bring up the next slide. But, until Joe gets
the grapes.
Yeah. If you look at what a bunch of grapes looks like, and you look at what the blood cells look like under a microscope, the cluster, very, very, very similar. So
even with the sugar in grapes, it's still great for the blood.
It really is. There's, a lot of people talk about wine and the beneficial effects of wine. It's the resveratrol that's found in the grape that is beneficial to the body. And in fact, the grape seed probably has about 100 times more antioxidant effect than the actual pulp. And the skin actually has more beneficial effect than the pulp. So It's just kind of interesting to know. This is an interesting picture. If you look at a kiwi, and a kiwi next to what an allergen molecule looks like. There are certain foods that precipitate allergies in the body. And I can tell you that kiwi is probably one of the highest allergic type foods that there is.
Why is that?
Well, it has, for whatever reason, it has there's a sensitivity that the human body has against whatever chemical it is or particle it is in the kiwi. But if you look at how that fuzzy appearance looks like, and you look at what a allergen molecule looks like, it looks pretty similar. You can go to the slide. And interestingly, while we're talking about kiwi, if anybody has the tendency to make kidney stones, kiwi precipitates oxalates in the body. And so if somebody has a history of, let's say, kidney stones, kiwi probably is not the best choice for them. If you look on the slide now, this is what an olive looks like. You can see on the left, and then you can see with the picture of a gallbladder. And clearly there's studies now showing that olive oil helps to flush the gallbladder. If anybody has, problems with gallstones, olive oil with citrus actually has been found to be very, very beneficial. The olive oil decreases the LDL cholesterol, and it increases the good HDL cholesterol. And so it's just a very, very nutritional kind of a thing.
Joe in studio.
And if you see, green olives stay fresher in jars while black olives stay fresher in cans. So that's just another little tidbit to kind of keep in mind. Okay. As we move on to the next slide. This was the nutritional value to grapes. We can move on to the next slide.
Hold on just a second, okay?
Do we have a question there? Well, while we're having some problems with the pictures, yeah, there you go.
Okay.
Onions, if you look at the cross section of an onion, it very, very closely resembles what the cross section of human bone looks like under a microscope. And, the studies show clearly that onions have a beneficial effect on helping to actually increase the calcium deposition into bone to protect the bone, so that the bone doesn't become brittle, so that the bone doesn't become osteopenic. Onions have that beneficial effect. Let's move on to the next slide.
Rita just called in from Mesa wanting to know if juicing would bring these the benefits of the raw fruits and vegetables to her.
It's interesting because juicing, if some people who don't like eating fruit, if they juice and they get the fruit, then juicing is a great thing. On the other hand, a lot of times people add extra, sugar and ice cream and yogurt and that kind of thing that increases the caloric intake. That may not be good. But I can tell you that if you juice, it's not a bad thing. You're still getting the nutrients. I don't know that there's a whole lot of difference in terms of whether you eat it raw. For example, if you eat an orange or you juice it, a lot of times you miss out on some of the nutrients if you eat it in whole form. The fiber, those kinds of things. If you don't get the pulp, a lot of times you miss out on that. So it just depends.
Does it ruin the food if you cook it?
Sometimes it does, sometimes it doesn't. Interestingly, you'll see a slide here, but for example, carrots. a lot of people think that eating carrots are more beneficial and nutritious, and I got to tell you that slightly steamed or cooked, the body digests it and breaks it down better. So it's more available, bioavailable to the body if you cook it versus eating it raw.
And can you cook it in like a chicken broth? It's still okay,
Sure.
or does that? Okay,
Absolutely, you can. And so, yeah, I think that's a misnomer. A lot of people think that raw is always best because, cooking it in the heat, you lose, and sometimes you do in certain foods. But I can tell you that in a lot of, vegetables and fruits, you don't really lose that nutritional component, especially in carrots, for example. Let's look at romaine lettuce here, for example. High folic acid. Folic acid is very important to protect the skin. And if you look at what romaine lettuce looks like and you look at the dermis of the skin, it looks very similar. And again, something to keep in mind that the layers, the way that the human skin is layered, looks like the layering of lettuce, and romaine lettuce in particular has a very beneficial effect because of that. Now just keep in mind, anytime you see vitamin K acts against certain medications that people may be on, for example, Coumadin. So you've got to be very, very careful in eating green, leafy type vegetables if somebody, for example, is on a blood thinner like Coumadin.
And vitamin K also, doesn't that build up in your system?
Well, it's made in the system, so that the liver actually makes vitamin K. It's a natural endogenous. But A, D, E, and K are what's called fat soluble.
So they're not sloughed off.
Exactly. So you can build up, high amounts, and you can actually become toxic. So you've got to, be careful not to ingest if you're blocking it, especially if you're on Coumadin.
And you can literally turn like orange, couldn't you, from vitamin...
Well, carotene, beta-carotene.
Beta-carotene.
And A, that's right, yeah. You can move on to the next slide there.
Sweet potatoes.
This picture is really interesting because sweet potato is probably one of the oldest vegetables known to man.
Wow.
And it closely resembles what the human pancreas looks like. And just clearly, if you look at that picture, and again, most of the nutrients are found in the skin of the sweet potato. You can move on to the next slide there.
It's amazing because these really resemble... Is this a scientific book or did you come up with this?
You know what? Over the years, probably over the last 5-6 years, I've kind of collected literature and data. I don't know of a book. Maybe one day I can put a book out called Picture Perfect
That's
Food.
right.
Because I think it would be really interesting to validate it with a lot of the research backing that there is. But there's an anti-inflammatory effect that's found in the sweet potato, and some studies show that it does help to protect and prevent even pancreatic cancer. Now, that's saying that is I have a hard time saying that anything like that prevents cancer, but certainly it's not going to hurt. And if somebody has the tendency toward pancreatitis or inflammation of the pancreas for whatever reason, sweet potatoes are a very good addition to the diet.
But remember, guys, around Easter time when you go to the Honey Baked Ham store, those sweet potatoes are not the same.
When you have all the sugar and everything with
right.
it.
Nothing against the Honey Baked Ham store because we love it there. But
all right. Let's move on to the next slide. Tomatoes. We're going to come up and you'll see in a moment the picture of a cross-section of a tomato and the cross-section of the human heart. And there's 4 chambers, in the heart, and there's 4 chambers in the tomato, and you can see that clearly we know now that tomatoes have a beneficial. It's the lycopene.
It can't be a coincidence.
I don't think there's a coincidence in any of this stuff.
No way.
Yeah, let's go to the next slide. If it comes up, we'll talk
oh yeah,
about
for sure.
the lycopene and the antioxidant effect that the tomatoes have in the body. What happens is that there's a lot of free radicals in the environment. You can go in pollution in the air and in the water and, all around us.
But that's what a free radical is? How does it, this is something that enters your body?
It can, yes. It enters the body, and there's what's called a scavenger, which is an antioxidant, and it scavenges, and it gets a hold of that radical, and it basically destroys it.
So radicals just fly around in your body and make you sick?
They can, and they can affect cells and cause those cells to mutate, turning into even potentially cancer cells. There was a study just out, not to get too far off, but there was a study out showing that diesel fuel has a clear, direct effect in causing lung cancer. So by inhaling those fumes, it causes a problem in the body. And so you've just got to be careful. Let's go to the next slide.
And you know, it's funny you said diesel fuel. A lot of people like the smell of fuels.
Yeah.
That's weird, isn't it?
Well, yeah, but it's very, very toxic to the body. This is a neat picture, the walnut. It clearly resembles the human brain. And, there are studies now looking at the omega-3 fats in walnuts. In fact, there's some recommendations that say, you should eat a handful of walnuts a day.
It even has the skull.
It really does. It really, really does. Yeah. The calvarium, it's amazing. Let's move to the next slide. And what you'll find is that it's highly, saturated with omega-3 fats. It's a great fiber. Low levels, it's interesting, low levels of omega-3 fats have been linked to clinical depression. And one of the things that I've been talking about and I've been thinking about, and I would love to do a study, would be, in children, there's a lot of kids who have nut allergies, allergies to nuts. And, they don't eat walnuts. And, is there an incidence, because of the omega-3 fats, an incidence toward ADHD, attention deficit, or depression in children because of the low levels of omega-3s?
Restaurants are supposed to post by law if they use nuts or
because of allergies,
shellfish, or a few other things.
Right. Yeah. But I think that we're missing, that benefit of the omega-3 in the body, and just 4 walnuts increase the level of omega-3 fats to a protective level for the body. So I think that's important. Let's move on. Winter squash. You look at the shape of the squash, and you can see the anatomical shape of a man's prostate. And it looks very similar. And we know clearly that squash has a beneficial effect in helping with the inflammatory changes that occur in the prostate, with benign prostatic hypertrophy and those kinds of things. So, so I think that's important. I think the next slide coming up is a picture of, let's see, I think we have a banana now. H. pylori is a bacteria. And I want to just take a moment and talk about this, because this is something that a lot of people suffer from: gastroesophageal reflux, GERD. Sometimes people have stomach ulcers and ulcers and so forth. And it can be tracked back to a bacteria. And a lot of times, people take antacids and take Prilosec and Pepcid and, all these different things over the counter. But if the antibiotic is not eradicated with an antibiotic, then it's just going to harbor and stay in the system. And studies show that sometimes those ulcers, or H. pylori particularly, can lead to stomach cancer.
And there's a way to test that.
There is a way to test that. And the way to test it is, there's a couple different ways. One is through a simple blood test. The other way is if somebody does an endoscopy or has a scope, they can take a little washing and look at it. But under the microscope, if you look at what H. pylori looks like, it looks very similar to the shape of a banana. And the reason I bring that up is because bananas have been found to actually have an antibactericidal effect against H. pylori. So it doesn't completely eradicate it, but it does tend to help kind of minimize what we call the virulence, or the aggressiveness of the bacteria. I don't know if you can go to the next slide, Joe.
Oh, absolutely.
But I think I have some things written out that kind of outline the nutritional value of a banana. You can see very high in potassium, B6, fiber, vitamin C. But bananas stimulate the cells of the stomach to protect against the stomach ulcer.
So what if you don't like bananas?
Well, that's...
Do they have banana pills?
I don't think they do, unfortunately. In your case, we would recommend an antibiotic to treat it. But the riper the banana, the more antioxidant effect. A lot of people don't like the real ripe banana.
The black ones?
The brown, yeah. And I can tell you that probably has more antioxidant effect than the less ripe ones. Okay, let's move on to the next slide. This is a strawberry, and of all the fruits, if somebody were to ask me what would be the number one fruit that you would recommend, if you couldn't eat other fruits, what would be the one that would be the biggest bang for your buck? I would have to say a strawberry, because strawberries are just packed with vitamins and nutrients and antioxidants. It resembles the human heart, as you can see, even in color, which I think is pretty amazing. But it's a great source of vitamin C. It has potassium. We'll bring the slide up in a moment, and you'll be able to see all of the nutritional benefits. There's the phenol content is what gives it the heart protective effect. And there's also some anti-cancer properties and anti-inflammatory properties that are all rolled into one with a strawberry. So again, my recommendation would be if there was no other fruit to eat, strawberry would be the one that I would recommend. Now keep in mind, and at the bottom of the slide here, you see that strawberries can interfere with thyroid function in people who have thyroid disorders. So that's just something to kind of keep in mind. Joe, why don't we just come back to the studio? We can open it up before we move to the next slide, which I want to get to in a moment. But I wanted to open up the lines to see if anybody had any questions. Remember, 480-745-1033. We'll be talking about stress in a moment. But
I turned the phones off for a little bit, now turn them on there.
Okay, because I'm sure that there's
I just was getting kind of lost and so.
trying to keep everything together. But isn't it amazing when you look at how the fruit really mimics and looks like the organ in the body?
It really does. Mm-hmm. Is there a fruit for every organ?
You know, I don't know. What I really would like to do would be to take this serious and really research it to a point where we can put it in a book form or in a form that would be a good resource, because I think that probably there's a lot more out there than what we have here. This is just a snapshot of really what's available. Anyway, let's move on to stress, because I want to talk a little bit about the physiology of stress. Today, stress is rampant. I mean, it's just there's so much. There's, in the hospital, we see probably over 50% of people come into the hospital due to stress. And I'm just going to share with you some facts about stress. Stress management training for heart attack patients reduced the recurrence of the heart attack by 40%. Now that's huge. When you think about it, if somebody had a heart attack and they went into a stress management type training, which is a relaxation, easy breathing type exercise program, it reduced the chance of them having another heart attack by 40%. People who meditate experience 80% less heart disease and 50% less cancer than non-meditators. So I think that really the message is that we've got to slow down. We've got to take time to breathe and to relax, because clearly 50% of all admissions to the medical facility are the result of stress. As a hospitalist, I see that every single day. Over 10 million people seek medical help for stress-related issues every year.
Got a couple of questions here.
Okay.
One off the chat board. What food would you recommend for joint health?
There's some things that I would first of all recommend that we avoid that can make joints worse. And there's, for example, eggplant. Eggplant has something in it that tends to increase inflammation in the body. So if you have osteoarthritis... So
eggplant's not good?
Eggplant is not good. That's exactly right.
Good, because I don't like eggplant.
Mm-hmm. Some of the other foods that decrease as anti-inflammatory, the sweet potato is a great anti-inflammatory type of a food. Onions are very good for musculoskeletal bone health. The other thing, chickpeas have a very beneficial effect. The chickpea, I don't know if you're familiar with it.
Oh, absolutely.
Yeah, but a lot of them in the Mediterranean diet, they make hummus and those kinds of dishes. Very, very good and very anti-inflammatory for the body.
And this brings up Sally from Westlake Village, California.
Mm-hmm.
Would like to know if there's a fruit or vegetable she can take for gout.
Ooh, that's uric acid. And again, some of the things that I would recommend avoiding would be, what they call the shade type eggplant. I would recommend
just
that you
just
avoid.
To let people know, is gout when your legs swell up and your...
What happens, gout is a whole metabolic condition where it has to do with uric acid and the metabolism of uric acid in the body. So there's deposits of these little crystals in the joints, and it becomes very inflamed and very painful.
Is that more of a back east type disease?
Not necessarily.
Do you see more of it back there? No?
Not necessarily. No, Joe. No. It has to, like I said, there's a hereditary component to it. It has to do with diet. And you've got to avoid, a lot of the high purine type foods. And so, that's really, but I can't think of a food off the top of my head that is specifically geared toward people who have gout.
Can you think of something that might help Sally out there in California?
Again, I think that just the general fruits and vegetables, very beneficial. Strawberry probably has a good, beneficial effect. And yeah, I'll have to look that up and maybe get back to her.
Do you recommend or endorse concentrated powders, superfoods in powder form?
Yeah, I do. You know what? I just want to get back to Sally's. One more comment is avocado. I believe that avocado has a very, very beneficial effect in the body in terms of people who have, gout and so forth. So that would just be my other recommendation.
Gotcha.
In terms of powder form, what was the question again?
Do you endorse concentrated powder superfoods in powder form?
It's hard to endorse anything unless I see it. As a medical physician I'm not a naturopath, nor am I a holistic type, doc. I basically practice, mainstream medicine. It's hard to really kind of endorse that. My recommendation from the studies that I've seen is that there's nothing that can beat fresh fruits and vegetables. Now, there are some protein type powders that you can use, and those are good. I think we had the isogenic people here a few weeks ago. Mm-hmm. And I got to tell you that if you want to take that off, we can just kind of chat. I got to tell you that I've actually started the Isogenics protein powder drink along with my family.
Yeah, how's that going?
It's a great nutritional supplement. And again, I think you've got to weigh the risk and the benefit. People who may have some gallbladder problems or maybe on some medications, and you've got to be careful with not overdoing it. I think it's a great supplement. So again, check with your doc. And but I've also seen people come into the hospital who've taken a lot of the muscle, protein type shakes and drinks out of, just way over the top, and they come in with some problems. And so, you've got to balance it, make sure that the kidney function and everything is okay.
Like the whey powder and all that stuff?
Whey is good. Whey is good. Again, not to overdo it. In the Isogenics product, the whey is actually from a natural grown, cow, actually from New Zealand. And so, again, knowing where the protein comes from, knowing that it's a natural fed, source, I think is very important. But again, nothing takes the place of fruits and vegetables in the raw and the natural state, as far as I'm concerned, based on the studies that I've seen, based on the research. Any other questions or comments?
Not right now.
Let's get back to the stress topic, because I want to just outline the different types of stress. Not all stress is bad. And I'm going to give you the 4 different types of stress. There's acute stress, there's recurrent stress, there's chronic stress, traumatic stress. Acute stress is the kind of stress that if I were leaving the studio today, Joe, and I got a flat tire, I would be stressed. It's 108 degrees out.
Right.
That would stress me out. But, within time I would get it fixed, and, eventually by the time I'm home, later in the day, the effects of that stress are not going to be destructive to my body. It's a natural response. Compared to recurrent stress, which is a stress that is more recurrent day in and day out, whether it be a financial stress, whether it be, for whatever reason, an emotional stress, sometimes recurrent stress, when it becomes chronic, it always has a potential to be destructive to the body. Stress attacks blood vessels, and that's a problem. What happens is blood vessels constrict, and we get decreased blood flow, and stress can lead to all kinds of different things, headaches and migraine headaches and heart attacks and, indigestion kind of symptoms, and just really, really bad. Traumatic stress is something that we just can't control. And it's really beyond the scope of our talk here, because, traumatic stress is something like a tsunami, something that is just way over the top. And the human body, without our permission, reacts. And we'll talk a little bit about that physiology of how that works in a moment. But the systems involved in the stress response are the nervous system, the endocrine system, the immune system, the cardiovascular, and the musculoskeletal. Stress affects all of those systems. And if you just think about it with yourself, those of you listening, when you're stressed, I don't know about you, but when I feel stressed, I have a very hard time concentrating. It's very difficult to think straight. The immune system is suppressed. And a lot of times when you find yourself feeling and getting sick, you can trace it back to a time when maybe your immune system was down. Maybe you were stressed about something, or for whatever reason, the immune system is down, we have a more tendency of getting sick. The cardiovascular system is affected, even the musculoskeletal system, where you get a lot of muscle tightness and aches and those kinds of things. Do you have a question there?
I do. We've got. It sounds like we're out of Africa today, doesn't it?
Yeah, you can hear the peacock out there.
Chandra, Springfield, Missouri, is suffering from cancer and going through chemotherapy. She is eating different herbs. Oh God, she told me one of the herbs, and I thought I'd remember it, and I didn't write it down. Anyway, she's eating everything from mint leaves to. She wanted to know. Have you ever seen any studies of people eating raw cannabis?
No.
For cancer?
I don't have any clue. I don't have any research to back that, so I don't know. That's kind of beyond the scope of my practice.
What about other herbs?
You know, there's a lot of beneficial effects for the body with herbs.
And we're talking about the fresh ones that are growing?
Yep.
Like wheatgrass?
Like oregano and mint. Parsley. You know, parsley is interesting because it has parsley is great for halitosis, for people who have, bad breath, and it's great for the gums and dental care. But it's interesting that parsley has something in it that, for example, when you, drink wine, people that get headaches, from wine and different cheeses and those kinds of things, parsley has something that, because it's high in what's called molybdenum, it tends to be an antioxidant and balance that. And so it kind of removes the side effect, if you will, of the headache that people get when they drink wine. So there's a lot of really interesting, beneficial things that you can find in different herbs. But again, you've got to be careful. It's got, you got to not overdo it. Anything in moderation, I think, is fine. Yep.
Right. We do have another question here. My friend is taking testosterone cream for aching joints, but is gaining other benefits. I'm 51. Is there a benefit for me using the cream?
Okay, that's a good question. There's a lot of studies looking at testosterone. And I can tell you that, you may want to take that slide off. I can tell you that testosterone, people who take testosterone, it's atherogenic, meaning that testosterone has a tendency to cause, in some studies, premature development of atherosclerosis. And so if you're on it, I would recommend that it's really directed medically. The cream, I don't think, is absorbed systemically as much. So
what is that? What is the sclerosis?
It means that there's hardening of the arteries.
Okay,
so people who take a lot of testosterone shots, for example, supplements by mouth where it's systemic, where it's in the body, there's a higher incidence of premature hardening of the arteries.
Is that like steroids?
Well, it's kind of like a steroid. Testosterone is a hormone. It's a hormone, and it's a male hormone. And obviously in men it's natural, just like in women. We have a little bit of testosterone, but women have estrogen. But when you supplement it outside of the care of a physician, you run the risk of developing high blood pressure, hardening of the artery, which leads to heart attacks. So I'd be very careful. Cream, on the other hand, I don't think is systemically, in other words, it's not taken into the body. It doesn't affect the entire systemic, body. So, that might be a little bit safer to use. But I tend to really stay away from supplementing with testosterone unless I see that there's clear evidence that somebody is lacking testosterone. And then in that place, you're just giving them replacement doses. And that's really important to know, I think. Okay, stress. Let's get back to the picture that we're going to show you up on the screen here in a moment. Is a picture that defines stress. When we're stressed, isn't this a natural? Your head. You have things tend to tighten. The facial expression tightens. Let's even go to the next slide. You tend to have a burning sensation in the gut. Nausea. All of these things are associated with stress. Let's move to the next.
And we're talking bad stress.
You know what, Joe? Actually, even if it's stress that you think we can handle, but when it happens recurrently and the body is under that stress day in and day out, what happens is sometimes you don't even know you're stressed. And sometimes people become addicted to that feeling, so that that it's almost like things have to be stressful in order for them to think that it's their new normal.
Wow.
And physiologically, it is destructive to the body. And that's really a vicious cycle. And that's really what I want to talk about today, is how do you break that cycle? Physiology today, aggression, stress, and heart attacks. Clearly, there's a lot of research showing that. Let's go to the next picture. Stress attacks blood vessels. And the next picture you're going to see up there is, and I don't know, I usually say, well, do you know what that picture is? And basically what that is a picture of the eye. It's a fundoscopic picture of what the blood vessels behind the eye look like. And, the eye is probably one of the clearest ways to visually directly see what the integrity of the blood vessel looks like. For example, if I'm examining a patient, when I look at you, I can't see your heart. I can't see what your blood vessels look like until I look in your eye. And it's when I look in the eye and I see that picture, it gives me an idea of the integrity and the health of the blood vessels in the body. I can see if they're narrowed. I can see if there's
By looking at the
streak.
eye, you can tell the whole body?
Well, it gives you a snapshot. It gives you a snapshot, and because the eye is probably where the smallest vessels are, when pathology, affects the body, this is one place where you're going to see it. For example, in diabetics, if there's a diabetic affecting the arteries in the body and the vasculature, it's evident when you look in the eye. And then from seeing the eye, I can pretty much say, well, you know what, there's maybe some hardening of the arteries going on elsewhere in the body, and so that's when you proceed with doing further workup.
Now, isn't this practiced in natural medicine, and it's called iridology?
No.
That's something different.
Totally different.
Ah.
Totally different. This is just a clear visual exam of the disc, of the optic nerve, and to make sure that there's no bleeding behind the eye and so forth. So, it's a clearly pathophysiologic, anatomical picture. Has nothing to do with iridology at all. I don't even know really what iridology
Gotcha.
is based on. Cortisol is a stress chemical in the body. And when we're stressed, it's the cortisol that tends to increase in the body. And high levels are associated with, the psychological stress, depression, and over time, what happens is cortisol causes deposition of fat around the abdominal area. And if you just think about it, those of you listening, when you're stressed, if there's ever been a period of time, whether you're going through a divorce or losing your job or, whatever the case may be, people tend to gain weight when they're stressed. And it basically physiologically has to do with cortisol causing that deposition. Now, increased cortisol causes all of these different things. In diabetics, it makes it worse because it causes what's called the breakdown of glycogen, causing more sugar to be around in the bloodstream. Cortisol increases wrinkles because there's less collagen in the skin. And, again, if you look at people and you think in your mind of people who you think are stressed, think about what they look like. Think about maybe what they looked like 5 years ago compared to now. Clearly, the studies show that cortisol causes increased aging and wrinkling in the skin.
It's funny that you say that because I've been doing this for a while now, and I see politicians from 4 years ago, and I look at them and go, wow, they've aged about 20 years.
Exactly.
That's from that.
That's exactly right. That's a perfect example of the pathophysiology of what's going on in the body. Now, as I said, cortisol causes constriction of blood vessels. And by constricting means tightening. And tightening blood vessels cause high blood pressure, heart disease, muscle fatigue. It decreases memory because you have decreased blood flow to the brain, inability to concentrate. You just don't quite see as clearly. That's why exercise is so vital to the body, to keep the blood flowing, to keep things moving and flowing, and that's very, very vital. So one of the things that breaks the cycle of stress and the effects of stress is exercise. And I think that's just, one of the things that we want to make sure that our viewers and people listening know is that exercise is really one of the antidotes to the effects of stress in the body. There was a study that just recently came out that shows that people who sit, for extended periods of time in the day don't live as long. I mean, so you think about, when I think about, in the day of a job, and that's, if sitting is predominantly what you do in your day, make it a point to get up and move around and exercise to get the blood flowing. And if we have time, I'd like to talk a little bit about blood clots, because this time of the year when people travel, we'll talk about, blood flow and blood clots. Let's move on to the next slide, though. Just to complete the thought and the conversation about stress. Now, the autonomic nervous system is in the human body, and there's two parts to it. There's the sympathetic and the parasympathetic. And I think a lot of people, have heard the fight or flight. I'm not sure that, everybody kind of has a good grasp on what that is, but just simply what that means is that, if we were to flee a dangerous situation, if you find yourself in a dangerous situation, the body responds without us giving consent. We're going to start sweating, we're going to start breathing heavy, our heart rate is going to go up, and all of that happens without us even knowing it. Without, we don't say, okay, start sweating, or okay, get your heart rate up. It's a natural, automatic response in the body. And when that happens, blood flows in different parts of the body. Blood tends to flow more to the muscles, because if there's the natural response is that if we're seeing danger, we're going to want to run away, right? And so that's how kind of the body is. Cortisol and adrenaline, it's an adrenaline rush. People, that may be a buzzword. People may know what adrenaline is. But that's what is up when we're excited. On the other hand, the parasympathetic is the opposite of that. That's when we're conserving energy. That's when we're resting and relaxing, when we're just ready to fall asleep. Acetylcholine, which is a different chemical, is up and cortisol is down. And blood tends to flow more to the internal organs for digestion, to relax. Things are calm. You don't need to worry about fleeing, the area. And what we would like to do as a medical physician, what I like to try to give my patients is the ability to turn the parasympathetic on and the sympathetic down. Now, how do you do that? Well, there's some ways, and music is one of the ways. Now, music, there's some negative effects that you see up here on this slide, but there are some positive effects as well. Slow movement, yoga exercises, Pilates, stretching, those kinds of things. But being that the slide up on the screen is talking about the physiology of music, I want to just speak to that for a minute. And music clearly is beneficial to the body. But as you can see, there's negative effects. When you have what's called the anapestic beat, the hard rock beat of music, it tends to cause the body to not turn the parasympathetic on, but cause the sympathetic to go up, and it actually causes muscle fatigue and weakness in the human body. Studies have shown that the hard rock type music leads to anxiety, increased anger, and the body itself reacts that way. Muscles tighten up. So I don't know if you can go to the next slide, but the positive effects of music, which there are many, and you may not have it up there. Let's just go back to the studio picture, Joan. We can talk about the positive effects of music are such that it aligns more with the Mozart 60 beat per second, and what it does is it tends to cause the breathing, the respiration, the heart rate to all come down to kind of a slower rate. We have a rhythm intrinsic to our body. And if we can kind of mimic that, then what happens is automatically we tend to move toward the parasympathetic, and things tend to slow down and calm down, increase blood flow, and simply just breathing begins that process. And so, those are the things that I think are important to know about the physiology of stress and how to break that vicious cycle. So those of you listening, just a recap on how to break that cycle, my suggestion would be slow, deep breathing. Very slow, rhythmic, nature-type music. Very, very beneficial. Avoid the higher, anapestic, hard rock type music. I think that's important. And then maybe some gentle stretch and exercise just to keep the blood flowing. Very important. Now, in diabetics, for example, we know that cortisol causes sugars to go up. Any of you out there that are diabetic, we know that diabetes is an epidemic in our society today. There's over 40 million people diagnosed with diabetes now. And if I were to give you a steroid, if I were to give you prednisone or solumedrol, which is a steroid, it's going to cause your sugars to go up. Likewise, if cortisol is elevated in the body due to stress, sugars are going to go up. It's the same thing. So the point is that it's important to keep calm and try to keep that vicious cycle of sympathetic response at bay in order to keep your sugars
That's
under
why
control.
diabetics don't take prednisones and things like that?
That's exactly right. They do. I mean, sometimes you have no
Right.
choice. But that's why we like to limit it and minimize it, because it can cause the sugars to just go way, way out of whack. And so it all makes sense when you think about the intrinsic and the endogenous chemicals in the body compared to what we put into our body. So I think those are a couple things. Any other questions before we move on to our last topic today? Anything else out there? Okay. That leads me to wanting to talk a little bit about insomnia and sleep, because sleep ties a little bit in with stress, and there's different types of sleep disorders. And I don't know if we have any slides there or not, but I'm going to kind of share with you. I don't think you have it up there. Yeah, we can just stay here. Insomnia, there's sleep apnea, there's restless leg syndrome, narcolepsy, there's different parasomnias, which is sleepwalking and screaming and so forth. And what I'd like to do is I'd like to talk a little bit about insomnia. Okay, there you go. Yeah, these are the different disorders. Let's go to the next slide, Joe. I just don't want to confuse our viewers here. But
Gotcha.
Insomnia is really the difficulty falling asleep. It's difficulty staying asleep. It's waking up too early in the morning or not feeling refreshed after a night's sleep. That basically is insomnia. So any one of those things.
I have that.
Okay. Now, we'll talk about the causes of insomnia, because there's different causes of why somebody may not fall asleep, why somebody wakes up too early or may not feel refreshed after a night's sleep. If you go to the next slide, what is the right amount of sleep for people? And the answer to that is really, it depends on the individual. I think you have the wrong slide there. You can keep that up there for a moment, but it depends on the individual. Insomnia is serious because it can impair mental function. People can fall asleep behind the wheel. And we know that over 100,000 car accidents occur, over 1,500 deaths per year can occur. Insomnia, whether it's due to sleep apnea or other causes, can lead to depression and heart disease and chronic headaches and uncontrolled high blood pressure. The bottom line is that it costs us over $100 billion in medical costs a year in decreased productivity, because people may not go to work, or for whatever reason, accidents and so forth. So insomnia is a pretty big deal. And what I see in the hospital a lot of times is it being caused by sleep apnea. Now, there's a lot of different causes, though. There's anxiety that can cause it, there's hormonal changes, pain, different medical conditions, even decreased melatonin, which is a natural hormone in the body, can cause it. But let's move on to the next slide, as they're following along this little lecture series. The right amount of sleep is usually 7 to 9 hours of quality sleep on average. However, some people do just well with 4 to 5 hours. The key is to make sure that there's a consistent pattern rather than the number of hours. So some people may do just fine with 5 hours of sleep and have always done fine with 5 hours, and that's fine. But if there's a fluctuation, if there's a change, that's when there's problems, and that's when you can have increased headaches and all the things that we talked about in terms of the side effects. You can move on to the next slide. The medical conditions that occur as a cause of insomnia, there's many. Restless leg syndrome, sleep apnea, Parkinson's, elevated blood pressure, people who have an overactive thyroid, meaning that their metabolism is so fast and they just can't sit still enough to sleep. Allergies can cause it, pain. All of these things can be a cause of insomnia. Our job is to find out what is the cause so that we can fix it. For example, if you have sleep apnea, we would recommend a sleep study. We would recommend a BiPAP machine, or a CPAP machine, really to help open the airway and keep the oxygen levels where it's not going to trigger for you to stop breathing and wake up, so that there's not that pattern of waking up in the middle of the night, 8, 10, 12, 50 times a night. So those are some of the causes of insomnia. You can move on to the next slide there. Okay, let's see here. Temporary causes, and this is important to know. People who are flying, jet lag can cause it. Caffeine, obviously, caffeine or alcohol. Working night shift, just being on that shift. In fact, there was a study out just recently that shows that there's a higher incidence of breast cancer in people who work night shift. That's huge. I mean, that to me tells you that the physiology of sleep is vital to the body and to the health of the body. There's an intrinsic clock in our body, and if we don't abide by that, then things are going to go awry. And, there's a higher incidence, and that was a really really shocking, conclusive study. We knew that there was kind of an incidence, or there may have been a correlation, but the study now shows that there's a direct correlation with working night shift and having an increased incidence of breast cancer. So that's not good. You can move on to the next slide. So insomnia is tied to stress, and that's why I kind of put the two together. And if you look at the treatment, music that we talked about, which is a treatment for stress, movement absolutely is a treatment, meditation, all of these are medicine for the body. And so you can take that down, and we'll just talk. I think we have a call coming in, but just know that movement, music, meditation are all modalities that don't cost anything, and really don't have any significant side effects. And that's important. Now, does that mean that we never use medication? Absolutely not. There are certain medications that we recommend for people who maybe have depression or anxiety. Those kinds of things I think are important to keep in mind.
Question here. I have insomnia because my husband snores all night long. Any suggestions for him or me?
Well, that's the environment. That's the noise in the environment. And, what has to happen, number one, I would want to make sure that, does your husband have sleep apnea? And if he does, get him some help so that maybe then the both of you can have, a peaceful night. And otherwise, you've got to create a sanctuary and a space to sleep. And that means quiet. A lot of times, you want to darken the room so that it's conducive to getting a good night's sleep. Sometimes people need to move into a different room in order to fix the problem. But my advice would be, what's going on with the snoring? Can that be fixed? Because if you can fix that, then you might actually help to improve his life and maybe, prevent bad things from happening, and then both of you would have a good outcome.
Are things like the Breathe Right strips really a solution?
It depends. I mean, a lot of times people try that without having a definitive diagnosis. And the recommendation is if you suspect that there's sleep apnea, which is really what we're talking about here, increased snoring and having the obstructive sleep apnea, thick neck, where there's an obstruction in the back of the throat, that's a temporizing measure. And what I suggest is to get it taken care of, get it treated. Instead of putting a Band-Aid on it, and just kind of patching it, it's not going to really take care of the whole problem. Get the diagnosis, find out really what's going on, and then there's treatment for that, and that will really help to fix it. That's really my best advice to do. Now, some people say, well, I don't have insurance, or I can't do that. Then, until that time comes, if that's certainly a good temporizing measure. But just know that it's probably not going to fix the problem, in the long term. And then what will happen is elevated blood pressure results from it, higher incidences of depression and those kinds of things, even heart attack it can lead. So it's always best to take care of the problem to prevent further worsening problems, which are going to just compound costs and those kinds of things. So that's a problem. While we're talking about sleep apnea, let me just kind of give a little bit more about that, because I think it's worthwhile. 1 in 7 people are diagnosed with sleep apnea, or actually, have sleep apnea. It's a big number.
Wow.
Especially as our population, our children are becoming obese and, are growing, and sleep apnea is happening at a younger age. What happens is they have what's called daytime somnolence, meaning that they fall asleep in the day, because they're not getting adequate blood flow and oxygen to the brain. And what happens physiologically is that there's not enough nourishment in the brain to know that there was a restful night's sleep.
That's from insomnia.
That's exactly.
I get that.
Well, you probably have sleep apnea. I mean, that's right there. The concern that we have is that people who have that daytime somnolence, meaning that they fall asleep more in the day, oftentimes can fall asleep behind the wheel. And when that happens, you know what happens when you fall asleep behind the wheel. Car accident and people get killed. So that's one of the reasons why we really, really recommend that it be taken care of, because it's a really very easy treatment. The machine is newer, smaller. There's no noise associated with it. And what happens is it's a positive end pressure. It's a little nasal cannula device that people wear. And what it does is it helps to keep the airway. It presses and keeps the pressure to keep oxygen moving and air moving in the body.
And you can sleep with that on, no problem.
Absolutely. In fact, people who within 48 hours of using a CPAP machine have almost reversible symptoms. I mean, you feel much more energized, more awake. It's amazing. It's amazing what you see. I tend to diagnose it in the hospital when I see people who have what's called cyanosis. In other words, they have blue discoloration of the lips or, the fingertips, where you see that people just are not getting enough oxygen. So that's just something to kind of keep in mind as well.
Do you see that a lot?
I see it a fair amount. We see more people who, who do have, like I said, 1 in 7 people have it.
Blue lips.
Well, it's called cyanosis, where, that's more kind of at the more extreme diagnosis, or people who have it, pretty severely. But it could occur in anybody, and you don't necessarily have to have that as a criteria. But it's one of the things that we look for, obviously, is that you're not getting enough oxygen, and you end up turning purple, and that's a problem.
Wow.
And that's a real problem. It affects every part of the body. It affects the brain, because you're just not getting enough oxygen. It affects the heart. It affects the blood pressure. It affects, sexual function. It affects every part of the body. And that's why we recommend that it be treated. Now, snoring is the biggest hint. So, a lot of times wives will come in and say, my husband snores, and we'll go through it and find out that, yes, in fact, they do have undiagnosed sleep apnea. So those are some of the things.
And that's where you stop breathing completely?
That's exactly right. I mean, the body, though, has a really interesting intrinsic mechanism that if you stop breathing long enough, it turns itself on to a point where it automatically wakes you up so that you start breathing again. It's because it's the accumulation of carbon dioxide in the body. And so when carbon dioxide tends to replace oxygen, that's a problem, because you're not getting the nourishment of oxygen. And when you stop breathing, that's what happens. And then it triggers the brain. You wake up, you take a deep breath, then you start breathing again, and then a few minutes later you start snoring again, and then it's the whole vicious cycle. And people who have sleep studies can, have that cycle happen, hundreds of times a night. And that's a problem. Now, people who have obesity, who are overweight, obviously are perfect setup for that. But I got to tell you, I've had, lean, thin marathon runners that have had sleep apnea. So it just depends on, on the mechanism. It could be a central sleep apnea, meaning it has nothing to do with obstruction. It just has to do with the brain. So there's different types that need to be diagnosed. That's why I say if there's a suspicion, don't go just get the strips. Get it diagnosed and figure out what we're dealing with.
You just go to your regular doctor for that?
Your regular doctor, and you can get what's called a sleep study, where you spend the night, overnight in a sleep lab, and you're kind of wired up. You're wired for sound, and it's just one of those things that.
Are there a lot of other people there?
You have your own room, obviously, and it's a very quiet, very conducive to a good night's sleep space. You have a television, and it's really kind of.
I was picturing dozens of people on cots.
No, absolutely not.
Okay,
absolutely
gotcha.
Not. No, you have your own, quiet space, your own little sanctuary, and you're being monitored, and then you get up the next morning at 6 a.m. and the test is done, and then your doctor gets
cameras, diodes, the whole thing.
Everything. That's
wow.
Right. Yeah. But it's worth it, I think, to make the diagnosis. So I can't believe we're just about out of time here. Boy, that hour went pretty fast.
And I apologize to all of you that are probably that have been trying to call in and not getting through, but the multitasking thing isn't really working too well doing the presentation and the phones today.
I wanted to really show our audience the pictures, and that was why I brought the slides.
They were wonderful.
Yeah, and I thought that would, be, because it's hard to talk about something that looks like something when you can't see it.
Mm-hmm.
And I thought that would be an interesting way to do it. We have some really great guests up and coming. So stay tuned. We're going to be doing a couple shoots in the doc's office, dermatology's office.
That's right. We have the dermatology thing where I'm actually going out.
Right, and he's going to be
doing moles on your back.
On my back. So that's going to be interesting. We confirmed really a prominent eye doctor, ophthalmologist, who is a retinal surgeon. This is interesting. I just want our listeners to hear just the last minute or so. There was a gentleman who is a cataract surgeon. Fantastic. Confirmed he's going to come in. We're going to do a show. But in the office, they have many different doctors there. And one of his associates, who is a retinal surgeon, heard about DocTalk Radio. And he said, is there any way that I can be on the show as well? So, so we're going to have a retinal surgeon.
That is great.
Yeah, so we have some really good shows up and coming, in the next couple weeks. So please don't forget, go onto Facebook and like us if you haven't done that.
Please do, because that really gives us an idea of people that like the show. I mean, you got to physically go to Facebook /DocTalk Radio and hit that like button, and that means the world to us. So please do if you think about it.
Joe, I think we had over 1,000 likes in the last couple weeks or so. Which is really neat.
Picking up steam.
Yeah, so it's pretty cool.
So we want another 1,000 this week, guys. So please, if you find the time, jump on there, like it. If you truly like the show, that's the way to show it right there.
It's great. It's sponsored by Gilbert Hospital and Florence Hospital and Anthem.
And you can be anywhere. You can be on the top of Mount Everest with your laptop, liking us.
Very good. Well, we'll see you guys next week. Thank you. This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.